scenario like Sunday morning in Orlando is hard to fathom, even from thousands of miles away. But what if West Michigan was faced with such a situation? How would it look?
Could our hospitals handle it? Well, we brought that question to Spectrum Health. What do they do to prepare, and how ready would they be should tragedy strike home? A pair of blood-stained shoes. The closest will be to the trauma room at Orlando Regional Medical Center.
Oh my God.
They belong to a surgeon from Sunday night, one of the many responders who tried desperately to save.
It's emotionally draining.
Back home at Spectrum Health's Butterworth campus, Director of Emergency Preparedness, Julie Bolson, walks us through a hypothetical, a very real, prepared-for hypothetical. If a mass casualty happened in Grand Rapids, how would they respond? She says first, other cities or counties could send their EMS teams if the situation warranted. Victims would then be assigned levels of severity. The worst would go to Butterworth, a level 1 trauma center. The others spread out to surrounding hospitals on a need basis. Inside,
This hallway will be full.
just through the doors, patients would be assessed in and line the hallway.
Structured chaos.
Halfway down the hall, the level 1 trauma victims would go into the trauma bay. 3 mini hospitals inside one room. MRIs, x-rays, surgical tables, whatever the certified trauma team needs, they have. But not before 60 seconds of silence.
It's to take that deep breath, not just jump into things. It's a safety sort of thing.
In the most intense moments, a pause to make sure the next moments count. Could Spectrum handle an incident like Sunday?
Spectrum Health would be able to handle an incident like Sunday with the support of all of our partners within the area.
Spectrum is required by Joint Commission to practice at least twice a year for a disaster type of situation. Already this past year, Spectrum says they practiced for a mass event with 40 pretend victims coming through their emergency department. But obviously, every situation is different.
But the hospital has 20 to 25 different scenarios they run through just to be ready.
And they say, you know, an incident like Sunday causes them to go back and look at what they would do. But the healthcare organizations are such a close-knit community that they will draw from Orlando Regional Medical's experience to learn what worked and what didn't work.
They'll share that information.
Yeah.
Thanks, Casey.